Well, I think the main takeaway is that, that they're, we're just using these two SNPs, SNP1 and SNP2, if there's a potential therapy for modifying mutant Huntington expression in an allele-specific manner, almost 2/3 of patients would qualify based on our findings. I think what it means for me as a clinician is that we always talk about personalized medicine. We always think that that's really the wave of the future. Instead of just relying on, population-based studies, can I tailor a medicine to you, the individual? And I think, the way I'd read this study is that this is one attempt at looking at personalized medicine. And there may be other SNPs there that increase that number to a much higher than just 2/3. And that's kind of where we need to go. But I think from my perspective, what this showed is that you could test this hypothesis that at least 2/3 of patients would have this SNP on the same allele. You could feasibly do it, and we used the Huntington study group certified sites that were involved in this, and that we could do it quickly. So we got these patients recruited quite quickly, and we showed feasibility of this assay. So that's the main take homes I take home. Main take home from this study, that if I was a patient reading it, that I would think about. I think from my perspective, we're waiting to see when they will tell us if what dose they've found is the right dose. And I think my understanding is that those studies are still ongoing, and we're kind of excited to see where that goes. And I think ultimately, I think a lot of our patients are interested in seeing the next phase start. So I think we're all, one of the challenges in science is that you feel like it takes forever to get things done, but it's just the nature of like clinical research, and we kind of want things now. I think we were all feeling that with the COVID issue. Let's just give us a vaccine. Come on, let's get it done. But it's one of those painful processes of scientific discovery that sometimes takes longer than we want. But I think we're getting closer, and I think we're gonna be able to hopefully open a new avenue of treatment for patients once we finish this work.